Hey everyone, welcome to Nutrimania. Continuing the trend, today we are going to discuss top 10 herbs and spices. So keep watching our video to know all the information you need to know.
Now what is aloe vera? Aloe vera is gel from the leaves of aloe plants. People have used it for thousands of years for healing and softening the skin. Aloe also have long been a folk treatment for many maladies, including constipation and skin disorders. Modern day research into aloe vera benefits is mixed with some evidence showing it can cause cancer in lab animals. There are no food that contain aloe vera, so it must be taken in supplement or gel form. Some forms of aloe vera are safer to take than other forms, and chronic use is discouraged. Aloe vera also contains essential vitamins like vitamin A or beta-carotene, vitamin E, vitamin B12, folic acid, and choline. The plant also contains minerals which are calcium, chromium, copper, selenium, magnesium, manganese, potassium, sodium, and zinc. Here are some uses of aloe vera. Research backups the ancient use of topical aloe vera as a skin treatment, at least for specific conditions. Studies have shown that aloe gel might be effective in treating skin conditions including psoriasis, seborrhea, dandruff, minor burns, skin abrasions, skin injured by radiations, herb sores, acne, and anal fissures. Aloe vera gel taken orally seems to help lower blood sugar levels in the people with diabetes. It may also help to lower cholesterol. The results of aloe vera studies for other medical conditions have been less clear. Now, how much aloe vera should you use? Creams and gels with aloe vera vary in dosage. Some creams for minor burns have just 0.5% of aloe vera. Others used for psoriasis may contain as much as 70% of aloe vera. As an oral supplement, aloe has no set dose. For constipation, some use 100 to 200 milligrams of aloe juice or 50 milligrams of aloe extract daily as needed. For diabetes, 1 tablespoon of the gel has been used daily. High oral doses of aloe or aloe latex are dangerous. Ask your doctor for advice on how to use aloe. Now here are some aloe vera risks. Talk to your doctor before using it. Researchers warn against the chronic use of aloe vera, but if the aloe product is free of aloin, an extract of plant that has been found to cause colorectal cancer in rats, it may be okay as topical remedy for sunburn. Aloin is found in between the outer leaf of the aloe and the coir stuff inside. Side effects of aloe vera. Topical aloe vera might irritate your skin. Oral aloe, which has a laxative effect, can cause cramping and diarrhea. This may cause electrolyte imbalances in the blood of people who ingest aloe for more than a few days. It can also stain the colon, make it hard to get a good look at the colon during a colonoscopy, so avoid it for a month before having a colonoscopy. Aloe gel for topical or oral use should be free of aloin, which can irritate the gastrointestinal tract. Here are some other risks. Do not apply topical aloe vera to deep cuts or severe burns. People allergic to garlic, onion, and tulips are more likely to be allergic to aloe. High doses of oral aloe are dangerous. Don't take oral aloe if you have intestinal problems, heart disease, hemorrhoids, kidney problems, diabetes, or electrolyte imbalances interactions. If you take any drug regularly, talk to your doctor before you start using aloe supplements. They could interact with medicine and supplements like diabetes drugs, heart drugs, laxative, steroids, and licorice root. The oral use of aloe vera gel may also block the absorption of medicines taken at the same time. Given the lack of evidence about its safety, aloe vera supplements should not be used orally by children and by women who are pregnant or breastfeeding. Now I am going to tell you about garlic. Garlic is also known as Ilium sativum. It is used widely as a flavoring agent in cooking, but it has also been used as a medicine throughout the ancient and modern history. It has been taken to prevent and treat a wide range of conditions and diseases. Here are some benefits of garlic. Lung cancer risk. People who ate raw garlic at least twice a week during the 7-year study period had a 44% lower risk of developing lung cancer. Brain cancer. Organosulfur compounds found in garlic have been identified as effective in destroying the cells in glioblastomas. It is a type of deadly brain tumor. 3 pure organosulfur compounds from garlic, dads, and dads demonstrative efficacy in eradicating brain cancer cells, but dads proved to be the most effective. Hip osteoarthritis. Women whose diets were rich in alien vegetables had lower levels of osteoarthritis, potentially a powerful antibiotic. Diallyl sulfide, a compound in garlic, was 100 times more effective than 2 popular antibiotics in fighting the Campylobacter bacterium. According to a study published in the Journal of Antimicrobial Chemotherapy, the Campylobacter bacterium is one of the most important causes of intestinal infections. Heart protection. Diallyl trisulfide, a component of garlic oil, helps protect the heart during cardiac surgery and after a heart attack. High cholesterol and high blood pressure. The garlic extract supplements reduced high cholesterol levels and also blood pressure in the patients with hypertension. Prostate cancer. Alien vegetables, especially garlic intake, are related to a decreased risk of prostate cancer. Alcohol-induced liver injury. Diallyl disulfides or DADs, a garlic-derived organosulfur compound, might have protective effect against ethanol-induced oxidative stress. Preterm or premature delivery. Microbial infections during pregnancy raise a woman's risk of preterm delivery. Garlic is an antimicrobial and is associated with reducing preterm delivery risk. Garlic and the common cold. Prophylactic use of garlic may decrease the frequency of colds in the adult but has no effect on the duration of symptoms. Prophylactic use means using it regularly to prevent disease. Now here are some side effects of garlic. When taken by mouth, garlic can cause bad breath, a burning sensation in the mouth or stomach, heartburn, gas, nausea, vomiting, body odor, and diarrhea. These side effects are often worse with raw garlic. Garlic may also increase the risk of bleeding. Here are some nutritional facts about garlic. Garlic is highly nutritious but has a very few calories. Calorie for calorie, garlic is incredibly nutritious. 1 clove, about 3 grams of raw garlic contains manganese 2% of the daily value, vitamin B6 2%, vitamin C 1%, selenium 1%, fiber 0.6%, and a decent amount of calcium, copper, potassium, phosphorus, iron and vitamin B1 also present in the garlic. This comes with 4.5 calories, 0.2 grams of protein and 1 gram of carb. Garlic also contains trace amounts of various other nutrients. In fact, it contains a little bit of almost everything you need. Today our topic of discussion is ginger. Ginger is a plant with leafy stems and yellowish green flowers. The ginger spices come from the roots of the plant. Ginger is native to warmer parts of Asia such as China, Japan and India, but now is grown in the parts of South America and Africa. It is also now grown in the Middle East to use as medicine and with food. And here are some uses of ginger. Research suggests that taking ginger daily 30 minutes before each dose of antiretroviral treatment for 14 days reduces the risk of nausea and vomiting in patients receiving HIV treatment. Research shows that taking ginger powder about 500 to 2000 mg during the first 3 to 4 days of a menstrual cycle modestly decreased pain in women and teens with painful menstrual periods. Some research shows that taking ginger seems to work about as well as some pain medications like brufen, mefenamic acid or Novofen. Adding ginger to the medicines such as mefenamic acid also seem to be helpful. Abnormally heavy bleeding during menstrual periods, menorrhagia. Taking ginger might reduce menstrual bleeding in some young women with heavy menstrual bleeding. Most research shows that taking ginger by mouth can slightly reduce pain in some people with osteoarthritis. Some early research also shows that ginger gel applied to the knee or ginger oil massaged into the knee can also relieve osteoarthritis pain. Morning sickness. Taking ginger by mouth seems to reduce nausea and vomiting in some pregnant women, but it might work slower or not as well as some drugs used for nausea. Also, taking any herb or medication during pregnancy is a big decision. Before taking ginger, be sure to discuss the possible risk with your healthcare provider. It is also effective in high levels of cholesterol or other fats in the blood. Hyperlipidemia. Research suggests that taking 1 gram of ginger 3 times daily for 45 days lowers triglyceride and cholesterol levels in people with high cholesterol. Diabetes. Taking ginger seems to lower blood sugar in some people with diabetes. Doses of at least 3 grams of ginger per day seems to be needed. Lower doses might not help and ginger might need to be taken for at least 3 months before benefits are seen. Indigestion or dyspepsia. Research suggests that taking a single dose of 1.2 grams of ginger root powder 1 hour before eating speed up how quickly food empties out in the body of the people with dyspepsia. Taking ginger for 2 weeks might improve appetite, nausea, reflux, and other stomach problems in people with this cancer. Here are some nutritional facts of ginger. There are a lot of different vitamins and minerals in ginger. 1 tablespoon of fresh ginger has 4.8 calories, 1.07 grams of carbohydrates, 0.12 grams of dietary fiber, 0.11 grams of protein, 0.05 grams of fat, and 0.1 gram of sugar. Vitamins and minerals present in the fresh ginger in trace amounts. Vitamin B3 and B6, iron, potassium, vitamin C, magnesium, phosphorus, zinc, folate, riboflavin, niacin. These are all present in ginger. Now, what are the side effects associated with using ginger? Side effects of ginger include increased bleeding tendency, abdominal discomfort, cardiac arrhythmias if overdosed, central nervous system depression, if overdosed, dermatitis with topical use, diarrhea, heartburn, mouth or throat irritation.
Ginkgo biloba, or maiden hair, is a tree native to China that has been grown for thousands of years for a variety of uses. Because it's the only surviving member of an ancient order of plants, it's sometimes referred to as a living fossil. While its leaves and seeds are often used in traditional Chinese medicine, modern research primarily focuses on Ginko extract, which is made from the leaves. Ginko supplements are associated with several health claims and uses, most of which focus on brain function and blood circulation. Here are 12 benefits of Ginkgo biloba. It contains powerful antioxidants. Ginkgo's antioxidant content may be the reason behind many of its health claims. Ginkgo contains high levels of flavonoids and terpenoids, which are compounds known for their strong antioxidant effects. Antioxidants combat or neutralize the damaging effects of free radicals. Free radicals are highly reactive particles that are produced in the body during normal metabolic functions, such as converting food to energy or detoxification. Yet, they also have the potential to damage healthy tissues, contributing to accelerated aging and disease development. Research on Ginkgo's antioxidant effect is promising. However, it remains unclear exactly how it works and how effective it may be at treating specific disease. It can help fight inflammation. Inflammation is a part of body's natural response to injury or invasion by a foreign substance. In the inflammatory response, various components of immune system are recruited to fight against the foreign invader or heal the injured area. Some chronic disease trigger an inflammatory response even when there is no illness or injury present. Over time, this excessive inflammation can cause permanent damage to body's tissue and DNA. Years of animal and test tube research shows that Ginko extract can reduce markers or inflammation in both human and animal cells in a variety of disease states. Some specific conditions in which Ginko's extract has shown to reduce inflammation include arthritis, irritable bowel syndrome, cancer, heart disease, and stroke. While this data is encouraging, human studies are needed before drawing concrete conclusions about Ginko's role in treating these complex diseases. It improves circulation and heart health. In traditional Chinese medicine, Ginko seeds are used to open channels of energy to different organ systems, including the kidneys, liver, brain, and lungs. Ginko's apparent ability to increase blood flows to various parts of the body may be the origin of many of its supposed benefits. One study in people with heart disease who supplemented with Ginkgo's revealed an immediate increase in blood flow to multiple parts of the body. This was attributed to a 12% increase in levels of circulating nitric oxide, a compound responsible for dilating blood vessels. Similarly, another study showed the same effect in older adults who were treated with Ginko extract. Additional research also points to Ginko's protective effects on heart health, brain health, and stroke prevention. There are multiple potential explanations for this, one of which may be anti-inflammatory compounds present in the plant. More research is needed to fully understand how Ginkgo's affect circulation and heart and brain health. It reduces symptoms of psychiatric disorders and dementia. Ginko has been repeatedly evaluated for its ability to reduce anxiety, stress, and other symptoms associated with Alzheimer's disease and cognitive decline associated with aging. Overall, research results are inconsistent in this area. Some studies show a marked reduction in the rate of cognitive decline in people with dementia using Ginko, but others fail to replicate this result. A view of 21 studies revealed that when used in conjunction with conventional medicine, Ginko extract may increase functional capabilities in those with mild Alzheimer's. Another review evaluated 4 studies and found a significant reduction in a spectrum of symptoms associated with dementia when Ginko was used for 22 to 24 weeks. These positive results could be related to the role that Ginko may play a role in improving blood flow to the brain, especially as it relates to vascular types of dementia. It improves brain function and well-being. There is some speculation that Ginko may enhance brain function in healthy individuals. A handful of some studies support the notion that supplementing with Ginko may increase mental performance and perceived well-being. However, a large review of research on this relationship concluded that supplementing with Ginko did not result in any measurable improvements in memory, executive function, or attention capacity. While supplementing with Ginko may improve mental capability, there are no guarantees. It can reduce anxiety. Some researches indicates that supplementing with Ginko may reduce symptoms of anxiety. A handful of animal studies have observed reductions in anxiety symptoms that may be attributed to the antioxidant content of Ginko. In one study, 170 people with generalized anxiety were treated with either 250 mg or 480 mg of Ginko or a placebo. The group treated with the highest dose of Ginko reported a 45% greater reduction in symptoms of anxiety compared to the placebo group. It can treat depression. Mice who received Ginko before an unavoidable stressful situation were less emotionally affected by the stress than the group that did not receive the supplement. The study indicated that this effect was related to Ginko's anti-inflammatory properties, which improved the body's ability to cope when stress hormone levels are high. More research is needed to better understand the relationship between Ginko and how it may affect depression in humans. It can support vision and eye health. Very little research has investigated how Ginko relates to vision and eye health. However, early results are promising. One review showed that people with glaucoma who supplemented with Ginko experienced increased blood flow to eye, but this didn't necessarily translate to better vision. It's unclear if Ginko would improve vision in those who don't already suffer from vision impairment. It can treat headaches and migraines. Because of its ability to increase blood flow and reduce inflammation, Ginko may be an effective treatment for some types of headaches. It can improve asthma and COPD symptoms. Ginko may treat symptoms associated with respiratory disease because of its anti-inflammatory effects. It reduces premenstrual syndrome. Preliminary research indicates that Ginko may help treat both the physical and psychological symptoms of PMS, premenstrual syndrome. One study in 85 college students revealed a 23%